Good evening, everyone. My name is Steve Krupinski. I'm the marketing director at Michigan Radio. I want to thank you all for coming out for our first in-person Issues and Ale event in 86 weeks. So think back, March 9th, 2020. That was the day before Michigan's presidential primary, where it was still very much up in the air whether Joe Biden or Bernie Sanders were going to get the nomination. That was 2 days before the first confirmed COVID case in Michigan. And that was the date of our last in-person Issues and Ale event. We were talking about the Michigan primary at Lansing Brewing Company in Lansing. So we are thrilled to be back here in front of a live audience, as well as we have an online audience that's streaming us tonight as well. So I want to thank you. So if you've never been to an Issues and Ale event, this is our way of sort of engaging people in conversations about things that are going on, things that are important, and we try to do it in a fun way and have a beer along the way. So I want to thank you for coming tonight. We have a lot of our staff. So first off, let me big round of applause to the folks here at York for hosting us tonight. Tommy York. We are so thrilled to be here. We also have a lot of our Michigan Radio staff that are here handling engineering and everything, and our welcome table and everything else. If you didn't get a chance to stop at our welcome table, pick up some swag while you're over there. I also want to make a couple quick announcements to let you know this is our first, as I said, in-person Issues and Ale in a year and a half. We have another one coming up 2 weeks from tonight. We will be in Lansing on the Michigan Princess Riverboat, and Zoe Clark will be hosting a Michigan Politics Roundtable. It's on a boat. Yes, we will be on a boat streaming down the Grand River talking politics. And as Zoe and Rick Pluto like to say, talking politics and drinking beer, what could possibly go wrong? So we hope you'll join us for that. You can register for that event on our webpage at the events page at michiganradio.org. As I mentioned, this is our hybrid event we're doing. We're streaming it live as well as being here in person. For all of you here in person, when we get to the Q&A portion, if you have a question, just raise your hand. Suzanne Bellinger here is going to come by with our mic. Again, we are recording the event, we're streaming the event, so we want everyone to hear your question. So just raise your hand, we'll get you the mic so everyone can hear what you have to say. If you're watching us online, what we're going to ask you to do is just type in your questions in the comments or chat section, either on YouTube or Facebook, where you're watching this event live, and we'll get those questions to you as well. We also want to let you know that events like this and all the events that we do at Michigan Radio are made possible by our donors, Michigan Radio members. We know there are a lot of them here tonight. We want to thank you very much. If you're already a donor, thank you. If not, you can visit support.michiganradio.org to become a member. You can also stop at the table there and talk to Alex Parcell in our development department, and he would be happy to give you more information about that. All right, let's get started. Our host tonight is April Baer. You know April as the host of Stateside, Michigan Radio's daily talk show. You can hear each weekday at 3 p.m. and again repeated at 9 p.m. And she's going to tell you a lot more about our event and about our panelists. So big round of applause for April Baer.
Honestly, thanks to you guys for showing up. When the weather started going a little bit southerly yesterday, I thought, he's going to come on a rain date. There are enough things distracting us, even when you have an event like 3 months in advance and you know you're supposed to be there, and inevitably something will happen. That is actually what happened to a couple of the folks we asked to join us tonight. There were 2 panelists who had family medical emergencies. Yeah, it's just, I'm sure you're seeing this in all your lives as well. This is, we're in a stage of the Omni crisis where everything you could have put off has been put off, and now just a bunch of stuff needs dealt with. So Abram's laughing. I know he knows what I mean. Thank you everybody for coming. And it's so great to see you all still vertical and conscious. And it's just been such a year. Some of you know my family moved here right before the lockdown happened, and getting to know Michigan virtually was not really my preferred MO, but there's been so much going on over the past couple of years. It's really been a pleasure to hear some of your stories and to be with you through all this. Let me introduce who's here with us tonight. I am very excited at the all-stars who've turned out this evening. First of all is a guy who just really knocked us out when he was on the show with us a couple of months ago. Dr. Abram Wagner is a research assistant professor in the Department of Epidemiology at the University of Michigan. Hi.
Hello.
So, little story about Abram. When he was, I believe, an undergrad, there he was majoring in Asian languages, you know, getting ready for some sort of career, possibly in international affairs. And then he took this left turn into medicine. Who would have guessed that he would become one of our most valuable voices in talking about vaccine preventable diseases? And having had the experience of talking to people in China and other parts of Asia who are dealing with the same things we're dealing with. And I know that one of his special fields of interest is vaccine hesitancy. So obviously we've had a lot to talk about with him on the show. We're tickled you're here. Thanks for coming.
Thank you for having me.
Yeah. Also here, yes, that's great. Over on the far right, Crystal Fluker is here. She is taking time out from her job as director of the Arrowwood Hills Community Center with Washtenaw County Community Action Network. The Arrowwood Hills is a co-op, and there are 350 affordable townhouses that are part of the complex on the north side of Ann Arbor. And Crystal and her team provide a whole variety of services to the families there. Stuff for the kids, you know, helping out with academics, things like camps, but also things that are on the parents' minds, like food distribution and just helping them get what they need right now, which is not a small job. Crystal Fluker, it's a great pleasure to have you here.
Thank you for having me.
And to my immediate right, Preeti Malani, the Chief Health Officer for the University of Michigan. We are thrilled to have you here. She's also Professor of Medicine at Michigan Medicine Infectious Disease. And she's had an interest in gerontology issues too. So her expertise has been especially helpful, sort of thinking through both what's going on with students and faculty and staff at the U of M, but also some of the folks who are the hardest hit by COVID right now. Preeti, it's great to see you. Thank you.
It's good to see you again in person.
We were just remembering, Preeti was one of our last in-person studio interviews before everything went sideways in March. And we were like, hey, wow, there's this disease that's happening. Do you think it might be a big deal, Preeti? She set us straight. Yes, and everything followed therein. We want to definitely make time for your questions. And for those of you watching on the stream, please don't be shy about sending them in. But I have a few things that I wanted to ask our guests just as we get things started. How are you, everybody?
Doing well. Thanks for the alcohol.
You know, I feel like Michigan is not a super easy place for people who are trying to, you know, get on the wagon. And I'm not even joking. Like, I really despair of what this year and a half has been like for people who need to stay so, you know, who are working on sobriety, because it's just, these have been really trying times. And yeah, it's a friend to some and just a thing for others. Crystal, how are you doing?
I am doing well. Thank you for asking. I have enjoyed working with Community Action Network, and we really find solace in helping our community partners with what they've needed during this time. So it's crazy during such a pandemic and in what was 2020 and what I thought would go away and we could leave in 2020 when we rolled the calendar over, that didn't get left behind totally. By helping others, it's really given me some fresh air myself. So it's been good.
Like some people, like I know, Abram, you've been able to work online a lot, but Crystal, I mean, you're providing direct services for people. I bet you and your staff really haven't been in front of computers as much as some of us.
So no. So Community Action Network, we have multiple sites around Washtenaw County. So my counterpart, Skylar, is here. He's at the Bryant Community Center. They service all of Washtenaw County, whereas my site is just within Arrowwood Hills, which is a fixed community center. So no, we do in-person service, but still socially distanced as much outside as we can. So we ran a full summer camp this summer. We did outdoor programming with them. We did a food distribution, as you just mentioned. These are things we've continued throughout the entire pandemic. We just had vaccination events trying to encourage people to first get educated about the vaccine and then to choose to get vaccinated if they would like. So the Washtenaw County Health Department was present to provide them with the information and have access to the vaccine if they chose to. We had a back to school event. So yes, we do, everything we do is in person.
Shutdown did not really shut things down.
It did not.
Preeti, how about you? You've had these thousands of people, sort of in your charge, from fresh green undergraduates to staff and faculty who've been part of the university for decades. How are you doing with all this?
I'm doing well, and I remain optimistic for where we're headed. Certainly, it's a lot better than last year, but when we think back to when we met in the studio, it was February. And then what happened in the coming weeks, it was like a switch went off. I mean, it really didn't, but it felt that way. And getting back has been much more of a dial. And we dial up, we dial down. And I think there's some frustration with that. But I think there's also this, the folks that are maybe doing the best are the ones who recognize that we have to adapt and we have to figure out how to move forward safely and minimizing risk for everyone, but also moving on with things that are important. So, it's so much better than last year is what I would say.
Yeah. Just a quick show of hands. How many people, okay, what are we? This is September 15th.
Right? Who's feeling better than they were last September
15th? Anybody feeling worse than they were September 15th last year? Okay, I see you. Be sure we get the mic around to you. I want to hear about your year. Anybody else who raised a hand? That goes for everybody on the online stream too. We're looking forward to hearing about your stories. However, let us
get to a few opening comments. I mean, Crystal, one of the things I was really curious about for you is, the center works with a lot of kids. The kids that you and your staff are seeing, what shape are they in right now?
So I think when we talk about children are extremely resilient in ways that we don't tend to give them enough credit for. Whereas we tend to be a little more fretful or worried. They've been doing really well. We also have made it a point through things like our summer camp curriculum to build social emotional supports and education, mindfulness. So we are very mindful, if you will, to build in supports to provide for our children that we service through our many different communities. So where we had students who weren't ready to return back to organized programming, some who didn't want to leave their in-house support system. That was a long time to be home with mom, dad, grandma, grandpa. What we could do our best to do was really love on them, support them, provide some care and concern for them, welcome them back, slowly readapt them before they headed back to school in the fall. Yeah. So we really were grateful to be able to be a bridge program to them before they headed off to school. So they're doing well. The children are doing well. But they still need a lot of love and support from adults to get back to where they need to be.
You were a classroom teacher in Ann Arbor's public schools and Detroit's public schools before the job that you're in right now. I know you haven't been teaching this year, but where are your thoughts going as all these kids head back into the classroom face to face? Not all of them, but many of them.
I just admire the work that has been done over 2020. There really have been so many barriers that have been broken down when I see the efforts that teachers and school staff have just gone through to reach students, to meet them where they are, to meet parents, to do things like Zoom parent-teacher conferences and orientations, things that weren't, they were kind of shunned before in education. And now they're welcomed and they're sought after in ways that those four walls no longer just stand in the way of, especially when you're thinking of students that Sky and I service, whose parents may not always have transportation to go get into the school building. So it really, as much as, to go back to what you were saying, to think of some highlights, right? Some bright points in our educational system that has helped us really to transcend those four walls and to find ways to reach out to the families in ways that educationally hadn't existed.
If you're wondering who Sky is, Crystal took us at our word when we said we were throwing a party, and she brought a friend. Skylar Woodman is here, director of the Bryant Community Center. We're hoping we can ask him a question or two here a little bit later.
Absolutely.
Yeah. What about these kids' parents? I mean, what are top concerns for them right now? I mean, they are living in, a rent controlled environment, but like what are the top things that are keeping them up at night these days?
So I would say things like you've mentioned. So returning back into school settings, where is COVID going to shut down the schools again? Are they going to be safe? Are those things? They're wearing a mask all day. So we do a lot of calming their concerns. And as you mentioned before, about letting them know that we're adapting, that we are adjusting, that together we're going to get through this as we've been doing. So that's been a concern. Rental assistance. And I know I said I welcome Sky to the party. I did, because he does a lot more with housing stabilization assistance than I. And certainly that, especially during the beginning of this pandemic, was a huge concern here in Washtenaw County. So things like making sure their rent was paid, making sure they weren't falling behind on DTE or other utility bills when they may have not received pandemic funds or unemployment funding, or just being uncertain. So those things, I believe, were looming, especially in 2020. Fortunately, there has been lots of funding that's come through that's really helps, like pandemic EBT funding and the CERA funding that's helped with rental assistance.
When we were doing an update the other day on federal unemployment payments, I'd forgotten, like, there are four different classes of federal unemployment payments. Like there's just a lot going on. Some of that, of course, has just ended. Could you hazard a guess of the families at Arrowwood Hills? How many of those households had people who still had to keep showing up for work all through this? Could you ballpark for us?
I can't guess an amount. I know when I was driving in daily, there were certainly many of vehicles driving out.
Yeah.
The beginning of it, not so much. I remember driving on the roads and I'm like, it's just me, which was a little nice. There was no traffic. And then, as time progressed, you got to see there were lots of people who continued to go into work regardless of what their jobs may have been, and were even relieved when things opened back up more and got to go back to work. So I think they found themselves, there was like a renewed gratitude, if you will, that it's like, yes, they called me back to work. I get to go back to work. I'm grateful to go back to work, because you were unsure for so many months. So many people were. We just weren't sure if so many industries were going to be reopened. And that was many of their conversations, because we saw spikes in houses that typically would not participate in the food distribution or our food pantry that we keep on site. There were spikes in different people who I knew would typically be at work during the day. They weren't. They were able to come in, shop our food pantry. And it was disheartening. Even though you're happy to provide the service, it was disheartening because they wouldn't typically need that service, if that makes sense.
100%. Preeti Milani, we were just talking about the school situation, which I think is really top of mind for a lot of people, whether or not you have kids right now. We're talking about a year that's going to have consequence for the entire society
in years to come. How closely does the university have to monitor what's going on in K-12 schools?
Well, it's a good question. And again, it's the entire community is important. And last year, one of the big concerns was, is the university going to drive cases throughout? And, there were definitely lots of cases at the university last year. And again, it was pre-vaccination. And even with social distancing and masks, it was in the social setting that these things happen. And actually, some of the sequencing work that was done at Michigan Medicine showed that there wasn't a connection between those cases. They ended up kind of staying within the university, minus people who might go home. Students went home, maybe infected family members, which is unfortunate. And that, that was part of, and again, my own family has a student there, and we had to sort of make some
Did you read the Riot Act?
No, well, not so much, because I think, again, you can't get to zero risk even now with vaccination. And I'm very proud to say our rates are outstanding.
Mm-hmm.
There's not zero risk, but risk can be acceptable. And I think when I think about the K through 12 space, what you're doing is really important. This isn't like a non-essential activity. It's an essential activity, as is face-to-face learning in the higher education space. And, for that matter, all these other things that we've learned to do. But it means, with public health, what I do affects you, what you do affects me. And that gets lost in this sometimes, that it's not just, well, I'm not at risk, so I don't care. Which, thankfully, I don't hear a lot of people saying that, but that what I do affects you and what you do affects me. And so a lot of it is that idea of trying to recreate things in a way they weren't meant to be. Like school wasn't meant to be on computers. College wasn't meant to be socially distant. And there's a cost to that, socially and emotionally and academically. So anyway, I've kind of gone.
Well, that's okay. I mean, there was something like a university. If it's hard enough, we've seen towns like college
like Adrian coping with trying to, get control of their infection rates. Ann Arbor is a pretty large college town. And we've talked to the president of Wayne State, Dr. Roy Wilson, about, how you do that when you're in a city like Detroit, and there's just a lot going on. There's also contact between the U of M and countries around the world. But I just wonder, like, if you had to, guess like what some of the key points are that you need to keep an eye on. I hesitate to call them vectors because they're kids. I've got one. She's not really a vector, but what if it's the community spread, if it's contacts with other counties and other states, or if it's schools, what are you keeping an eye on?
Well, one of the things that's important is that we think about students, we think faculty and instructors in the classrooms, but there's a whole heck of a lot of other stuff that happens at the university in the research space, finance. And as people are coming back to working in person, one of the things I worry about is those interactions, which are longer, and you may be in more crowded spaces, and it's hard to wear your mask all the time. And what we find is when spread happens, or there's a cluster of cases related to a workplace, it's often, whether it's at the University of Michigan or elsewhere, it's usually with eating. And so it's like finding places for people to eat in the winter. That's hard to do. So think, and again, at the health system, this is the case too. It's very crowded there, and you have a lot of people, and it's not zero risk. So in that sense, what's happening, not just in Washtenaw County, but in the surrounding counties and our state in general, it does matter, because those are people coming into the space, not so much because it is going to affect the students or that the students are going to affect them, because frankly, their interactions aren't in the social setting.
University of Michigan was one of the big schools that came out early saying that vaccination was going to be mandatory for undergrads, whether they were on campus or whether they were going to be attending classes virtually. Can I ask, I've been wondering about that. Why did you decide to extend it, not just to folks who would be in Ann Arbor, but for folks who were affiliated with the university and still going virtual?
Well, I think there are multiple reasons. And, just what we initially did was required vaccination in the residence halls. because we said those are students we're responsible for. They're living in a setting that is really impossible to make safe, short of nearly 100% vaccination. I'm proud to say we're at about 99%. There's very few exemptions.
How did you do that?
Well,
Wait, is it 99% not counting the religious exemptions or 99%?
that's there may be about 1%
Okay.
exemptions. And there's a few that are in process, international students, but in the residence halls, we're nearly almost everyone's vaccinated, which is wonderful because that was the epicenter of a lot of outbreaks last year, a lot of clusters. And we were happy with that decision. And, our hope was that the rest of campus would also have very high vaccination rates. And, to be honest, no one really knew, but we just said, we think they'll be high. And what happened was in July, the world shifted again. There's so much churn, but July was a time of a lot of churn. And
With the Delta variant.
with the Delta variant. And I actually was rounding on, seeing patients who had COVID and other infectious disease. And what I was starting to see was troubling me in terms of breakthrough infections. Not that we see a lot of people hospitalized, but we did see some. And I was hearing about some from friends. And I'm like, that's really strange because a few months ago we said, if you're vaccinated, you're safe, throw away your mask, go on with your life. And then all of a sudden it was like, gee, wait a minute. And as that was happening, that was the moment where I think everyone agreed with vaccination, but it was how do you get to it? And, there's a cost to mandates, not just a political cost or an economic cost, but it's a lot of work to verify this stuff.
Yeah, well, especially, when you're talking about an international student and faculty population, there are other vaccines from other places in the
That's
world
right.
that aren't Pfizer, Moderna, or help me,
J&J.
Johnson and Johnson.
Yep.
Yeah.
And in fact, we have a whole process around that, like Sinopharm, depending on which country, and again, I'm looking expert on China here, but depending on where in China it was manufactured, it did or didn't fall under WHO. And so there was a lot of work that went into verification. And we also wanted to make sure any students that were joining us internationally knew that when you get here, we'll take care of you, we'll help you find a quarantine space, and we'll vaccinate you. And we just did the second dose last weekend. So for a group of students. But, anyway, this piece just felt very essential. And I think as we did it, as we announced it, many of the schools, so Wayne State, Michigan State, other schools followed suit. And I think that's important for our whole state. And I know we're going to talk about vaccine hesitancy, but, April, one of the things I talk about a lot that I don't think gets enough attention is not just the public health piece, which is obviously that's enough for me. It was a very easy decision for me and my family.
Yeah.
But I recognize it's not for everyone, but economics and disruption, academics and economics. I don't think we talk about those two things enough because if you end up getting COVID, you're going to be out of school. You're going to be out of class for 10 days or longer. And if you're unvaccinated, you may be sick for a long time. Unfortunately, we'll talk about vaccination, but we're not going to prevent every infection, but we're preventing illness.
Right.
And we're preventing spread of illness. And we're seeing it already, like we're holding our breath, but it's looking pretty good so far.
Yeah.
On a campus that looks pretty normal.
So I don't mean to hold your, well, we'll get back to that.
Yep.
Before Abram Wagner's been
Yep.
waiting so patiently down here. Abram, there was something that you said to me maybe last week that,
or just I don't remember if it was the last time we talked, but the fact that the vaccines, the Pfizer vaccine now has full FDA approval. We've run into a lot of people who've said, you know what, these vaccines are really new. I feel like I'm not certain. And now we're in a place where the Pfizer vaccine at least has some full approval. Have you learned anything about how willing people are now to get vaccinated now that there's a product that meets that criteria?
Yeah, so we do know that anecdotally, there are people out there who have said, I want to wait until the vaccine is approved by the FDA before I get it. The interesting thing about that is I'm sure a few years ago, no one knew what the difference between an EUA and full approval was. But certainly people can express these preferences. And for some people, there is a strong preference. I would say overall in the population, there is not a huge difference in people wanting to get a vaccine, which is FDA approved or not. But there is a certain subset of the population, maybe a bit more of the vaccine hesitant folks, who have been waiting for this full approval. And it is something which has been important for them. I would say that there's all sorts of other issues which are at play, but as we've seen throughout the vaccine rollout, there's been fewer and fewer people who've expressed strong oppositions for it. So starting in February, maybe 30%, even more, would say, I'm strongly opposed to getting a vaccine. But in more recent surveys, that's gone below 20%. So there are people who, at some point they were strongly opposed to getting vaccinated, but over time they've been seeing other people in their social groups getting vaccinated. I think that's been really important. I saw my mother or my friend, they got vaccinated and they didn't get sick.
Normalizing vaccines.
Yeah, normalizing the vaccines is really important. I do think this FDA approval is really important, although I think it's also really important for giving a motivation to certain workplaces to mandate vaccines, because I think a lot of places were kind of waiting for full approval before doing that.
And now the barn doors are open. It feels like there's been a new employer every day that we've heard from. What do you think is going to happen with those mandates for workplace vaccinations, especially for larger companies?
Well, first off, I want to say that these vaccination mandates have been used in the United States forever. There was the 1905 Supreme Court case, Jacobson versus Massachusetts, which said that the government could mandate smallpox vaccination into the population. It was this public health measure. The Supreme Court realized that it might infringe a bit on people's liberties, but they said that in the balance of public health, this was important. So I think there is this legal precedence to having a mandate. Certainly, I think there will be pushback. There will be pushback in certain groups. And, I'm sure we might talk a bit more about booster shots, or some people might raise some questions about that. But at this point in time, I'm not so interested in getting booster doses into people who are already who have already been vaccinated. I'm thinking, how can we get people who are not vaccinated to be vaccinated? The people who haven't gotten any dose so far. I think that's more important.
That's actually a question I wanted to put to you and Crystal. We're in a place right now where the waits for getting a COVID vaccination have kind of dried up. I mean, there are places you can walk in and just get it done now. Or if you want to talk to your doctor, there are some primary care docs who can help you out with that, although that's not a huge number yet. But I just can't help but wonder, we're at this place where the larger venues in Detroit and Grand Rapids, the mass vaccination sites have closed up, and some of the counties' efforts to meet people where they are, people who have, heavy work hours, who can't show up between the hours of 9 and 5. Some of that has dried up. Abram, what do you think is those people who we're thinking about, who for whatever reason haven't done it yet, but might still be reached? What does your observation tell you might be most critical to getting them on board?
Yeah, I think the access thing is huge. I love talking about vaccine hesitancy and what people's psychological decision-making processes are all about, but making the vaccine easy to get is really important. So in surveys I've done, we've even asked people, if you were offered a vaccine right now, would you take it? And this is for people who haven't been vaccinated, and a large proportion would. So I think just that easy access is really important. Another thing is, do you have somebody who you trust, including your primary care physician? Are they reaching out to you? So there also have been studies which have said that if your doctor's office reaches out to you and says, we have an appointment for you to get vaccinated tomorrow, can you come in? That's hugely important. That can drive uptake of the vaccine. So I think things like that are still really important. Yeah.
Crystal, you work with a lot of folks who maybe don't keep banker's hours, so to speak, in their jobs. What are you seeing? Do you think that there is a population out there of people who would be willing to get the shot if we could just find the right time and the right place to have the conversation with them?
Yes. I think that we have tried at Community Action Network to also bring that to them by doing it during our back to school barbecue,
social events.
Yes.
Yeah.
So making it just a normalized part of it's here if you would like to do that. So yes, we did see some people accept that. We did see even more people have that conversation who weren't ready to get vaccinated, but who were open to having a conversation, which I thought was great. So yes, I do think accessibility, just being educated about the vaccine and your options, those are all great things. Yes.
So it can be done if providers can find folks where they are. Preeti, I think there were some last minute campus opportunities for folks to get vaccinated. What worked there?
You know, I think we've learned a lot in recent years for how flu vaccine is distributed. And you think about that being such a success, you know, the retail pharmacists, schools and churches, you know, places of worship, you know, just everywhere and anywhere. And I think that COVID vaccination, at least in the last few months, has been like that. And I think they've continued to, you know, with this latest wave, there have been people like a slow trickle, but a steady trickle to trying to meet people where they are. But you know, one of the things that we've done on campus is with the health service is offer appointments, these advisory appointments. And again, they're not required, but for anyone who wants to have a discussion, judgment-free, like talking to a clinician, it's mostly the nurse practitioners that are at UHS, and they're great listeners and very knowledgeable. And I think that's been helpful.
I saw some signage that said, still not sure about COVID-19. I love that it led with the question, you know, that it was just sort of, it wasn't get your vaccine now. What's wrong with you? Why haven't you done this yet? It's just, do you still have some questions about this? Like, you know, ready to talk about it.
Yeah, I don't know that that whole message anymore about go get vaccinated probably moves a lot of people anymore.
Yeah.
Because people are a little bit dug in at this point. I mean, I don't know, you know, maybe with people's children, they're still a little bit like they want to hear from the child's doctor or primary care provider. But people have shifted because what we saw in the late spring was there wasn't a lot of virus going around. And then as things have surged in recent months, people who are, you know, kind of waiting. But then you have people who just really don't want it. And so I think reaching them, asking them why.
Yeah.
And then trying to address the why.
We do know that in Michigan and really across the country, there are medical systems where it's been a problem to get all staff on board with vaccination. And I don't know, looking at U of M numbers, if that includes Michigan medicine staff. Can you tell us if the vaccination rates we see also apply to them?
The overall vaccination rate does include that, but there's some little subtleties. And again, someone who's more familiar with the dashboard can comment, is there are a few groups that are covered with unions. And so they don't have to report at this time, but some of them have reported, but they're not included in the numerator, but they're included in the denominator. So the rate is actually probably higher. It may be closer to 87% than 81%. But the point is it's not 100%. I mean, we have a ways to go, and that the gap is not random.
Yeah.
You know, the highest group is physicians, and then it kind of goes down from there.
What are those conversations going to look like? I mean, are you worried you're going to lose people over this?
You know, again, I live at Michigan Medicine and I work there, and fortunately I'm not dealing with a lot of that, but I think that is a concern. But other health systems have similar requirements. And I know in other states, they've kind of all gone in together because of that issue, because of that concern. And there are more requests for religious exemptions than there are normally for flu vaccine. So, you know, that's a concern.
I do wonder when we hear that medical facilities are losing staff, there's been ample opportunity for burnout over the past year and a half. So, I mean, if you're losing people over a vaccine mandate or because they've had the year and a half of their life, I don't know how you sort that out.
And one of the concerns too is outside the hospital per se is nursing homes. You know, as some of these rules may apply nationally, and again, the understaffing or like losing people, or people had to take care of their kids because they were, you know, and a lot of, you know, gets at every equity issue has just had a big light shined on it in the last year and a half.
100%. When I was looking at Michigan's vaccination rate, Abram was telling me something that really shocked me. Here's one for you. Vaccine coverage in Florida is higher than Michigan.
Yeah, I mean,
Is this true? How can this be?
This is true. At least when I checked last, and I think here in Michigan we like to make fun of Florida. Everybody does, but
They can't handle the winter. They can't handle it.
But yeah, we've been saying for so long, oh, they're just low vaccination coverage state. This is why they've had so many cases of COVID-19. But I think it goes back to kind of what Preeti was saying as well, which is as the number of cases have increased in Florida, which happened earlier this year, there just was a huge drive of people to get vaccinated. So I think that definitely was part of it. But I also like that statistic because I don't think we here in Michigan should be complacent, or we should just think that it's going to pass us over. Certainly we were one of the last states to get hit a lot with the Delta wave, but I think it's here, and I'm hoping that we don't have the situation here in Michigan like we have seen in the Southeast with, ICUs being
just
overflowed.
buried.
But yeah, but it's definitely a possibility.
Right. We have a question from one of our online audience members. Janelle writes, should a young person who got the Johnson & Johnson vaccine in April get a mix and match booster to increase protection? Okay, Janelle, I appreciate the question. We do have 2 MDs here, but I would not say that anything in this response should take the place of a conversation with your own physician. Preeti, do you have thoughts on this?
This is one that I'm hoping in the next few weeks we'll have something more definitive, because there's some concern around people who got a single dose J&J vaccine or the Janssen vaccine, and they likely do need some sort of booster or additional dose, but that guidance is not clear. And so, one thing that is good is that a lot of those vaccines actually went to young, healthy people, like college campuses. We were ready to do a big drive.
Right, because they didn't need the cold storage.
Because it's a single dose, you're done.
Right.
I mean, it has and actually it's been used with a lot of success in incarcerated individuals and people who are houseless and other populations that are high risk. But what I would say is hang tight, continue to use reasonable judgment in terms of the things you do, as we should all do, including those of us who had 2 doses of the mRNA vaccine.
Yeah.
But I think we need more guidance on that.
For sure.
Yeah.
We had another question from Yvonne, who asks, how about a mask wearing 50-year-old who's healthy and living alone? Again, I would encourage everyone with these kinds of questions to make an appointment with their primary care doctor. I think, though, Yvonne's question really speaks to the fact that a lot of people don't feel like they have someone to have that conversation with, which, speaking of the equity light that's shining on us all right now, I don't know. Do you have any thoughts on the substance of her question?
Yeah, absolutely. And I'll just say this, and again, nothing replaces having a good conversation with a primary care provider or other doctor or other provider that knows you well. But the risk of clotting with COVID is much higher than the risk of clotting from a vaccine.
Really?
Yes. And the risk, the overall risk. And again, I think risk is a funny thing. And I'd be really curious to hear Abram's thoughts on this. But we sometimes the risk feels really high, and other times it's feels really manageable. But yet, I drove here in a car. I'm going to get on an airplane next month. We do things that are high risk. I walk my dog in the dark.
Yeah.
There's things we do that present risk, but we accept it. And with the clots, especially the J&J vaccine in younger people, clearly there's a signal, but it wasn't that high. It's on the order of a couple per 100,000, but we tend to think of our own risk as really high. And on the flip side, right now with Delta circulating, if you're not vaccinated and you're circulating at all, you're likely to get infected.
Yeah.
Just because the risk is so high. The infectiousness is so high with this variant.
We do know that community spread in Michigan is everywhere, basically, right now.
So, you're taking that risk, which if you develop infection and if you're 50, on average, you have a higher risk of having a poor outcome.
Yeah.
So to me, it's an easy calculus,
Yeah.
but I think, again, good discussion, but that risk of blood clots is not a contraindication.
Abram Wagner, I know social gatherings haven't been what they used to be, but I really feel sympathy for the guy who's the epidemiologist at social gatherings. And you probably have any number of people coming at you every day asking about risk and what Preeti was just talking about. Like, how do I navigate my risk right now? What do you tell them?
So it's a great question. And I think Preeti even brought up something earlier, which is what is the risk that we as a nation, as we as a state, as we as a university have decided is acceptable for COVID-19? For instance, I have a student who is working with me on a project. She's Chinese, and so she went back home to China, and she's basically had a month-long quarantine. She had to spend 2 weeks in one city. She flew to another city, was there in a hotel for a week, and then had to be by herself in her family home for a week. So China is an example of a country which has very low risk tolerance for COVID-19 and still has had some outbreaks, but certainly not to the extent that we have had here in the United States. Whereas I think here we've said that it's a bit more acceptable. And certainly we have more of like a freedom and a liberty-driven culture, but there are flip sides to that. So I would say everybody, you have to take your own tolerance for risk into account. But as a public health person, I want you to think about other people as well. And one of the bad things we've done with messaging is just to say, oh, wear your mask for others, get vaccinated for others. I don't think
really, that surprises me to hear you say that's not going to hit.
Well, because I think Americans don't care about others in general. They care about they care about their mother, they care about their father, they care about like their aunt or uncle, but they don't really care about the other. And I think that's sad. But yeah. So I think if we actually had more directed messaging of, get vaccinated for your grandma, I think that would actually mean a lot more than
or your kids who are too young to be vaccinated.
Exactly. For those people around you who can't be vaccinated.
For sure. I want to make sure we get in some questions from our audience here at York in Ann Arbor. Is anybody in the mood? Suzanne from the Michigan radio staff has a stick mic. I saw one right back there, and then there's one up here too. We'll get you next for sure.
Oh, all right. Just real quick, Abram. Vaccines don't really protect others; they protect you. Masks protect others, right? I mean, what is actually the epidemiology there?
Here we go.
That is such a great question. And that's the $1 million question. Can the vaccines protect against infection? So a great question. And I think we've seen mixed results in the research earlier on. We just weren't really sure. But then we had seen that there had been some evidence that the vaccine does protect against infection. I would say that still the vaccine does. I think I'd be comfortable with that messaging that the vaccine can be used to protect other people. But I don't think it's 100%. And I do think that our immunity towards the vaccines probably wanes a bit over time. And as part of that waning, probably, the protection against infection and transmission to others probably wanes a bit as well.
Stop me if I'm oversimplifying. If you're vaccinated, and you're exposed to COVID, the viral load in your body will be lower. Is that correct?
I think that's probably pretty safe to say.
Okay. And feel free to jump in, Preeti.
Yeah. So again, with Delta, what we're finding is that the viral load may be the same, but it comes down quickly. And again, this is sort of emerging stuff. Right. And one of the things we talked about a lot with vaccination was that vaccination is more about protecting everyone around you than protecting you. But then we found out, wow, it really protects you well. And there's some data that came out in May, which actually prompted the dropping of the mask for fully vaccinated individuals. But then, we're kind of back to this. And I'm talking a lot about that distinction between illness and infection. And we also are finding, and this is why who's around you matters. And so anyone who's vaccine eligible around you, if they're vaccinated, your situation is better, because as someone who's fully vaccinated, if I do get infected and have symptoms, I'm more likely to spread to people that are unvaccinated than I am to people that are vaccinated. And it's a lot of moving pieces, but basically, like, get vaccinated if you haven't been, not just for you, but for everyone around you.
This is hard. Crystal Fluker, I just saw that within the past week, the state of community spread in Michigan for COVID right now is to the point where the CDC says that we really should all be wearing masks when we're inside, regardless of vaccination status. And yet people are just so, I mean, with their own families, this is exhausting. What kinds of considerations do you hear people saying when they're trying to figure out, like, I'm in this public situation, I'm at work, I'm going shopping, like this I'm going to mask or I'm not going to mask?
Well, at Ken, we are masked and we are all vaccinated. So 100% of our agency is vaccinated and 100% of our agency masks. So we're in the space who we still, because our agency, we consider ourselves protectors of others, right? So most of the residents I work with are seniors. So I really care. So while I do understand that many people don't care about the others, I've been fortunate to work for an agency who the others is what drives our work. Right. So the others are what matters most to us. So when we talk about caring for those who aren't vaccine eligible, the younger children. So that's most of our work one way. And the other extreme would be our senior population, who many of them have gotten vaccinated and who came like not running literally, but up to the center to show me their vaccination card and to talk to me about it. It was a big deal because they trusted me to talk to me about it. And we had a conversation about it too. Like, I was open to having those conversations with them about it. And so were my other coworkers in their respective centers. It isn't a conversation that we shied away from. It isn't something that, like you mentioned earlier, we didn't browbeat them about. We didn't make them feel bad that they weren't open to having it. It just was a simple conversation. So I am fortunate where I have had more people who find themselves masking for themselves and for others. I put on my mask for myself as well, but I feel like I was a person who was okay with wearing the mask because even during flu season, I don't want your flu either.
How awesome was it not to have a cold last winter? My 11-year-old is back in school now, and we're just like, we had a question toward the back. Suzanne, do you think we could find that one right there? There we go.
Yeah, this isn't as much a question as I'm going to push back on the whole idea that we have to cajole and encourage people to get vaccinated. Substitute vaccination with drunk driving. We don't say, golly gee, the public health experts suggest that maybe you really shouldn't get behind the wheel if your blood alcohol is a certain level. What we say is, no, you cannot do that. And as far as the concern about health professionals leaving the field because of a vaccine mandate, what about the other side of it, which is the nurses particularly, who are experiencing tremendous burnout and PTSD and suicides because they're asked to do an impossible task. And we're also not looking at the morbidity and mortality that comes from people who cannot get life-saving medical care because our beds are occupied by COVID folks, and it's mostly a pandemic of the unvaccinated. And our hospitals are not yet at that level, but I see it coming. And I also want to push back on the University of Michigan. You were not leaders in this. You were very late to the game in instituting a vaccine and mask mandate. It was only after Indiana University implemented the mandate that U of M finally stepped up to the plate, and holding super spreader football games with no vaccine mandate, no masking, no capacity control, yelling, screaming, and singing is exactly the opposite of what leaders and best ought to be doing.
Forgive me, but we're going to need the rest of the hour just to respond to every single thing you brought up. So we'll see what we can get to here. Oh boy. All right. Where to begin? Okay. So what about the idea that we need to go to the unvaccinated with an open hand and an open mind? There's we've been through several different flavors of conversation about vaccination. I don't know, Abram, you deal so much with hesitancy. Do you think it's worth twisting ourselves into pretzels to reach, in Michigan, it's still almost 40% of people who are unvaccinated.
Yeah, so I think great points that were brought up from the audience member. So a couple of things on that. One is that I think there is it is worthwhile to have an open hand and say, it's okay to change your opinion. What are you thinking about vaccines? And to start that dialogue. I would agree that having mandates in place for certain jobs and for certain positions is the way to go. I don't have any comment on how fast the University of Michigan did it. But I will say in reality and in practice, people have a variety of reasons for not wanting to get vaccinated. And I would say as an individual, sometimes those frustrate me immensely. And I get very angry inside. I don't necessarily think that my anger expressed would change anybody's mind. I don't think me myself would actually be that great at changing anybody's mind, but I think it's talking with community activists like Crystal, it's talking with a primary care physician who you trust. I think those are the things which are going to change your mind. And I would say that, thinking from a health disparities lens, there's also deep-rooted suspicions in certain communities, for instance, in the Black American community, into the medical world, into their experiences with doctors and some medical racism that they've experienced. So I think for certain subsets, there are reasons which I can understand why they wouldn't want to get vaccinated.
Yeah. Crystal, do you have any comment on this?
I don't. I appreciate you bringing those issues up. I truly do, because those were many of the conversations I had in the community in which I serve were a lot of historical disparities and with being vaccinated, with health issues, racial concerns, and historical mistreatments.
Down to just not having a relationship with a primary care doctor.
Yes, that as well. People asking me, why would I do it? And, me standing firm on doing what was best for me. So I appreciate you bringing that to light, because it truly was about me having open dialogue about it. And I think the more, not just people who look like me having that open dialogue, people who don't look like me having those open conversations and acknowledging that these are valid issues, that I understand and I hear you, and acknowledging what a person is saying and their lived experiences, or even what isn't lived. It could have been their forefathers or their fathers' lived experiences. And so we can move towards some resolve with many of these discrepancies. Healthcare in Michigan does vary. I'll leave it at that.
Preeti Milani.
I just want to
I just wanted to say, I was in the stadium last weekend under duress. My husband said I was going to go to my first University of Michigan football game, and I went. We're vaccinated. I wore a mask, and I was glad to be wearing a mask. We had a good time, but would you speak to the discrepancy between what the university requires on campus and what happens in this more liminal space of the arena, the stadium, the other places that are under the university's control?
Well, again, I don't have all the answers. I don't think I'm going to make anyone happy with my response. And if you look around the country, this gets at sort of the other things that people have adapted to try to make happen. And again, to some extent, people decide whether to go in that space. Again, I understand folks might disagree with me on this. Our students are highly vaccinated. We're watching them very carefully. They actually are not having a lot of cases, and we're testing a ton of them, which is reassuring. Doesn't mean that
283, I think, to this point,
over 3 weeks.
Okay.
And again, 50,000 students. So and again, campus is not going to be safer than the community. So it's going to probably be less safe. And I think that's one message even from last year. As to the decision making by athletics and others around that, it's consistent with the CDC guidance. It is outdoor. Masks are recommended. They are required indoors. And again, President Schlissel commented on this at the town hall last week. And one of the points was also that unlike the classrooms, people don't have to go there.
Mm-hmm.
And again, I understand the optics of it, and I understand the concerns. Tigers games, Lions games, frankly, I think those communities are probably a lot less vaccinated than ours. And as things change, we have to change. And one of the things that's very hard with the entire pandemic is as things change, we have to shift. And that can lead to a lot of frustration for people. And that's kind of where they're at. I don't really have a response. I mean, beyond that.
Yeah. I apologize that we can't address all of the points. There is one other thing that I wanted to get to, and that's just survival going forward. There's a lot happening right now for people who have to work. And some of that has to do with how they're getting their bills paid. And Crystal Fluker, you alluded to the fact that you're talking to a lot of folks right now who have bills coming due from DTE, who have groceries that they need to get on the table for their families, and who have rent to deal with. I wonder, could we invite your colleague Skylar up here for a minute and just talk about in case you're wondering, Skylar Woodman is director of the Bryant Community Center. So he has the same kind of job as Crystal, just at a different center. Hi, Skylar.
Hey, how's it going?
I know you've been keeping an eye on the immense amount of federal money that's available to help people with rents right now. We keep hearing that not much of it has actually been used. What can you tell us? Like, what are you seeing? Are people even aware that the money is available when they're in need?
Yeah, and this is really a partisan issue. It's kind of trapped in Lansing at the moment. And as far as like the SERA funding goes, that's just it's being underutilized because it's under publicized. There's $9 million of $14 million available for both retroactive rent now, and then rent going into the future as much as 15 months, and that pays the landlord on behalf of the tenant. And so that's like only a fraction of it has actually been accessed and used.
Is that frustrating for you?
Super frustrating.
Yeah.
Absolutely. And it's tough to address because it's like, how do you better publicize that this it's really a groundbreaking watershed type of resource. We've never seen this kind of support exist in the community prior to the COVID timeline we're living in now.
I wonder how much of this is because because these systems of support have never been present before. Nobody would think that there would be that money available.
Yeah. And the cool thing about the SERA program is the client or the tenant and landlord, they can actually handle that on their own. They don't need a caseworker. Unless the literacy levels or something like that are an issue, or communication is an issue, technology, etc. But if you have a smartphone or a laptop or an iPad, you can do that from your own home.
I've heard of some states where housing courts have a SERA office on site, or at least a staffer. Like, before you walk into this courtroom, go down and talk to that person right there and see if we can head this off at the pass. Do you know if that's the case in Washtenaw County or anywhere else around?
Yeah, it's the case sensitively. They are here and there, but yeah, it should really. If I had to do it, I'd put them in every library. Put them at the farmers market. Put them out front of the grocery store. There's pockets of Washtenaw County where poverty is generational and present, and is going to continue to be present. So it's like, why not go to the community and offer that resource up in front, rather than a website that not everybody is going to know to access.
Skylar Woodman, director of Bryant Community Center with Washtenaw County Action Network. Thank you.
You're so welcome. Thank you.
Hey, Crystal, can you come back up here and maybe leave us with a final thought? I don't know which flavor of anxiety is predominant for you right now, given everything that we've talked about tonight, but how are you getting through right now?
Personally, I have a husband and 3 sons, so I get through it with, I guess, chasing them around or being chased around. It just depends on what our evening entails. Pretty busy life. So, but on a professional level, really is servicing the people with which we work with, you know, it's seeing their faces at food distribution. I have enjoyed seeing people look healthy, and that's a state I don't think I appreciated before this pandemic. Just seeing the same people over and over was something I took for granted, and really, you know, people with whom I don't live, right? Just learning to really value the fact that I see you for several weeks. I see you in the next month. I hear your voice. You are well. So that keeps me working and thriving. The fact that I see the same people and that they are doing well. That has really brought me a lot of joy that before I did not value as a part of life.
So true. It's these small things that are keeping us alive right now. Steve Karpinski just reminded me we have some more questions in the audience. Please forgive me. I didn't mean to wrap us too soon. Please raise your hand if you have something you'd like our panel to address. Over here, I think. Can we go up here and then bounce up that way? Yep. Hey.
Hi, I'm wondering about the psychological implications of the pandemic. For example, I feel like there could be this cognitive dissonance between needing to like act normal, like go to work, go to school, as if everything's normal, but also knowing that the world is totally not normal. And so I'm wondering if you could talk a little bit about what is being done about that and what is also still missing.
That's huge. I don't know, Preeti Milani, when you talk about the mental health of U of M's students and staff, like how do you handle that one? Do we even know the extent of what we're dealing with right now?
You know, we don't know the extent. And, you know, April, I think there's lots of different pockets. And one thing I've said it like 100 times during the pandemic is COVID is not the only risk to our health. And like my daughter sort of mocks me because she hears me saying it a lot at home when, of course, she was learning virtually last year, like a lot of people's kids. And, you know, I say it over and over, COVID is not the only risk to our health. And with our students, you know, frankly, I can vaccinate them to COVID. I can't vaccinate them for loneliness. I can't vaccinate them for a lot of other things. It is a risk as a parent. And I actually am a Michigan parent as well. And my son is a senior at Michigan. So, you know, it's been disruptive to them also, but he's I think been very resilient. But, you know, when you talk about the students, like it's also the academic piece, and the well-being comes from really all those things. But that social interaction, and something I've talked about the entire time, is find ways to connect, be very deliberate about your connections, like go for a walk, you know, meet a friend for lunch. You don't have to go to a big party. You don't have to go to the football game. Like you don't have to do those things that you feel are not things you want to do and that, you know, potentially put you and others at risk, but connect with people, you know, and I think, you know, there's what I'm seeing is like sort of two extremes. One is like the pandemic's over, and not so much in Ann Arbor, but like you leave Ann Arbor, you don't drive very far in our great state to see very different attitudes.
For sure.
And on the other extreme is, you know, people who are still not comfortable leaving home, and how do you meet people in the middle? And, you know, again, I think not that it's normal, or that I just say it's like, and I don't like the whole new normal or we're getting back to normal, but that we're moving forward. And like, you know, it's hard. This is hard. And like, be kind to yourself and like, give yourself a break, and don't like put energy into something you don't need to do. So, you know, I do try to be aware. And I think one thing I'm seeing on campus is I'm seeing a lot of happy students who are interacting. And I ate lunch in one of the residence halls the other day, and there weren't a lot of people sitting by themselves, which I used to see a lot of that. So I don't know if it's just like my observation. I'm hoping that maybe this re-ups all of our need to connect in a meaningful way, you know, like all of you who are here tonight.
For sure. Abram Wagner, you were talking about some of the differences between the way risk has been handled in China and here. I'm going to ask this next question, recognizing that it might be a whole nother hour-long program. But do you hear anything from your colleagues overseas about how the isolation is, you know, what it's doing Are people talking about it? Is there, mental health is such a culturally loaded concept in so many ways, but what do you hear? This is a pandemic that has taken a huge toll in Asia, even though they've been able to get control of the outbreaks in a different way than we have.
Yeah, so I hear a few different things. One, I would say that different countries have been able to deal with COVID-19 a bit differently. Even vaccine availability varies widely. So I was just talking with a colleague from Indonesia the other day, and at least in his area, huge problems with access to the vaccine. I think he was saying less than 20% of people had been able to be vaccinated. So kind of the anxieties that you would have in the community would be very different than an area where the vaccine is widely available. And I would say in a place like China, when you're thinking of the mental health of their campus, I think they're able to have like a bit more of control around the student and the faculty. And so the idea is that, if you are tested negative, you can go into the campus. And I think it's kind of life, at least last year, it was a lot more of life, more normal than it was here in the United States, where we had to switch to everything being online. They were able to do a lot of face-to-face instruction just because they were able to have a bit more of a controlled environment. So I would say it's kind of what the balance is between what your risk tolerance is, what you are willing to, what kind of restrictions you're willing to be under. But I think there is something to being able to be face-to-face with other people. I'm an introvert. I like working from home, but it is nice having like my husband and my family around as well. So everybody's dealing with this in different ways. And I just hope that this shines the light on mental health and that it can be more socially acceptable to be going to therapy, that more workplaces offer counseling and things like that.
100%. There was another question down here on our right, your left. Anybody else? Are there other hands that we should? Okay, I see one back there, one down here. We'll do
Yes,
both.
April, I think you might end up asking this question. It's feeling like Groundhog's Day. What does 2022 fall look like? Are we still going to be masking and social distancing and?
Just felt my life pass before my eyes when you said that. Abram, what do you think?
Yeah, so I mean, it's a great question, and it's something that as epidemiologists, we've been thinking about a lot. What is going to happen to COVID-19? And I think at first we were thinking it would go the way of SARS, like it would just kind of disappear and we wouldn't have to think about it again. I don't see that happening, especially with these variants arising. Is this going to be something which is kind of more seasonal, like influenza, but potentially a bit more serious? That's possible. I foresee a variety of futures, but I think there are some things which I would like, in which case, for instance, if you're sick, not having to come into work or to school, it being more socially acceptable to wear a mask if you're just not feeling so well.
Please.
So I think those things are important. I do see COVID-19 being with us for a while, but I don't know 100% for certain.
Well, even this year has been a little different than last year. Not to say it hasn't been terrible for a lot of people. Preeti, do you have any other thoughts?
Yeah. So again, I'm optimistic about where we're headed, but we are headed to something called endemicity. This idea that COVID is here to stay, but we will manage it through vaccination. Vaccination is the only real way forward. And there does look to be some residual protection in people who have infection. It's not as good as vaccination. But that's a whole other, I don't want to get into that. But what will happen though, is if you look at a place like Iceland, which is probably one of the most highly vaccinated places in the world, I think about 95% of females and about 90% of males who are eligible are vaccinated. There are Delta infections there, but people aren't sick. They're not in the hospital. Schools aren't closing down. So I think what I see the future is being continue like sort of that march toward the things that we haven't been able to do, but this will be there. And again, we may dial up, we may dial down, we may need masks in the classroom. I mean, right now we need them because this it's not under control. But like fall of 2022, I would say like now, but better. But better, a lot better.
in a funny way, I feel okay about that.
Yeah.
We had another question down in front.
Yeah. Oh, okay. Sorry. Yeah, I just have questions about. I don't live in this community, and as we're starting to open up, I walk into a room. Sometimes no one's wearing a mask, and you do not know who is or isn't vaccinated. And the personal stress, in some ways, has gone way up because I don't know what risk I'm facing. I'm vaccinated, but I don't know that I won't get sick anyway. How do we manage this? It was almost easier just to stay at home and see everyone on Zoom, and I knew I was keeping my family members safe. And now I just don't know what my risk is. And part of me says, just get sick and have extra isolate, have extra antibodies and be done with it. But I'm just so tired of having to make that decision every time I walk into the grocery store or a meeting or any public place.
I really feel for you. I was in Fenton in Genesee County a couple of weeks ago, and I walked into a restaurant and I was the only person wearing a mask. And, you know, I can handle it, you know, but it's such a moment, you know, to have to feel like you're making a stand. Panel, did anybody else have thoughts on the commenters' point?
Yeah, I'm happy to comment, and I think your stress is real. This is something that a lot of people feel, and frankly, in the places where mask wearing isn't adhered to very well are also places that are not well vaccinated. You know, unfortunately, they go hand in hand. Now, a lot of people may have had past infection and there may not be as much, but, you know, I would say control what you can. So the more you can keep your meetings smaller, you know, to be honest, in the grocery store, you're not really up against people for a long time. So, you know, give yourself a little bit of a break, because I think that stress is actually not good for you either. And I think take comfort in the fact that you are fully vaccinated. I can't emphasize that enough. And again, there are individuals who are having illness, you know, a little bit, but they're not getting hospitalized. They're not dying. I mean, and I don't say that lightly because this is a bad virus and no one wants to get it. But that does matter that you are fully vaccinated. You have some protections. So remind yourselves of that. And then I think, again, like being careful about eating and wearing your mask, it does protect those around you, but it does offer you some protection as well. And to the extent that you can, you know, letting people know that you're not comfortable. But one of my good friends just dealt with this with his father's memorial service, where his siblings and him got into a discussion around this.
Oh, that's hard.
Yeah.
That's really hard. In the back.
So one, thank you for all being here. This is wonderful. I've learned a ton. And I was the one stressed, so you answered a lot of the questions that are stressed about stress. So thank you for that. But I'm a teacher, and I'm in Jackson County, and I have 11th and 12th grade, mostly boys. And I've seen more masks here than I have in 4 weeks of school so far, because we have no mask mandates. No one in Jackson County is pushing it. And I teach pre-engineering, so the kids are smart enough to understand the data. But we all know what 16, 17, 18-year-old boys are like. They're invincible, right? I was there. I get it. How do I, and this is where I'm looking for advice, how do I talk them into wearing their mask? Because right now, the ones who would wear their masks are the same ones that are already vaccinated. So it's like this catch-22, and I've heard lots of great things, but how do I, it's a 17-year-old boy. They're invincible, and I don't have the tools like you do at U of M to say you have to have vaccinations. I can spread them out in the class. I'm very lucky with that. But back to what you guys said too, with you need those social interactions. I guess I'm looking for advice. Like, what do I do?
So I don't know if the panel is going to have the magic bullet here, but Preeti Milani, you were involved in this National Academy of Sciences, Engineering, and Medicine report on how K through 12 schools were doing. I've got to believe there's so many educators out there who may be in a similar situation. Did you learn anything through the research process for that might help?
Well, again, that was pre-vaccine. And even then, last year, there was a lot of debate. And frankly, much of the world was, at least in the United States, especially in Michigan, a lot of things were remote. I would say to you, first of all, thank you for what you do, because what you do is really important. And you've been doing it all pandemic long. I will say, protect yourself. Like hopefully you're fully vaccinated and that your family is fully vaccinated. You know, breakthroughs are happening. Like I think when there's no masks, there are going to be cases, and it's going to be very disruptive to your students. And one of the things that I talk about, because again, engineering class is probably some high achieving students in there, is like, we don't want you to miss school. We don't want you to like miss 10 days of school. So wearing your mask is going to help protect you. Getting vaccinated if you haven't, you know, and again, I think this is a really tough, I don't have an answer to the divisiveness around this. It really shouldn't be, because it's the science, it's the virus. It's not a, a decision thing. It's like the virus doesn't care what you do. But I will say that if you can be a little bit further, like even 3 feet, 6 feet obviously is better. And then if you're wearing your mask consistently, that's actually very helpful. There's some, and actually this, this is like my healthcare setting where I work, which is very crowded. I have patients that don't want to wear their masks. Their family members don't. They're not vaccinated. Some of them have COVID. I will say that if you wear your mask properly, you're pretty well protected, not 100%. And being careful, I think, in situations where you're eating. And that's the best you can do. And if you're concerned about your family, you can layer routine testing on top of it for yourself, just to kind of, think about that. But I hope things will get better. And frankly, it's going to blow through the school. And a lot of people who aren't wearing masks and are not vaccinated are going to get it because it's too infectious.
Truths. We need to wrap this up, but I wanted to ask Abram Wagner first. Do you have any other final thoughts? I think we've delivered some comfort here, in addition to the realities.
Yeah, well, I think my co-panelists have said some great things as well. So I want to echo all of their thoughts, but I think we're going into the unknown a lot, and how resilient we are as human beings is really important. So I would say going forward, being able to find out what makes you operate well, what makes you be the best person in a healthy way, but also, physically, but also mentally. I think that's really important. So I hope one thing that we can get out of this pandemic is to pay attention to how we're feeling, and to react to that in a positive way. And I know there will be some uncertainties in the coming months, in the coming weeks. Like Preeti was saying, we're probably going to be seeing this Delta wave going through schools and going through our communities. That is going to be tough. Already, I think the statistic is that 1 in 500 Americans have died of COVID-19. That's a huge number of individuals.
Wow.
So I think I just hope that there's the support in the future for dealing with this trauma, and I think there will be.
Yeah. Preeti Milani?
Just again, thank you for having me at this conversation. It's been really interesting. There won't be a magic moment like there was at the start where this is going to end. And it doesn't mean it's not going to get better. It is. It will get better. And I talk to my own parents and my in-laws. I'm like, please have dinner with your friends. They're fully vaccinated. Have a gathering because it's too important. Like, we do need to take care of ourselves in every domain of well-being. So that social interaction in safe ways is important. And we said this all last year too. So yes, and if you are fully vaccinated, feel good about that protection. It's not 100%. We are seeing people get infected, thankfully not ill that much. And if you get ill, we also can take care of you. I mean, I don't want to really say that as a positive, but we're going to see illness. Almost all the people who are really ill are going to be unvaccinated. And over time, this will shift. And again, if you have family members who are unsure, encourage them to have a conversation, because the misinformation is something we didn't touch on. I think that it has been a very, very difficult thing.
That's on me. I feel like I've had enough of that to last me the rest of my life. Preeti Milani, a professor of medicine at Michigan Medicine Infectious Disease. She's also the chief health officer for the University of Michigan. Thank you. And Dr. Abram Wagner is here too. Preeti's a doctor too. I'm sorry. Sometimes I get a little fast and loose with the titles, but he's in the Department of Epidemiology, a research assistant professor at U of M. Abram, thank you so much.
Thank you for having me.
And Crystal Fluker has been here with us, the director of Arrowwood Hills Community Center with Washtenaw County Community Action Network, and her colleague Skylar Woodman from Bryant. Thank you both so much.
Thank you for having us.
We would be so remiss if we didn't thank York for hosting us. This has been an excellent venue. And thanks to everybody who was with us on our online audience. We love you. Mwah. Thank you for sending such excellent questions. I know we didn't quite get to all of them. And I don't mean to be a cornball, but especially if you're members, thank you. The fact that there are live streams now, this wasn't a thing 15 years ago, 10 years ago. So thank you for helping us continue to find ways to get stuff to you in the virtual era. Alex Parcells over there, if you want to talk a little bit more about that membership thing. Everybody stay safe out there. Wear a mask, get vaccinated. We love you, and good night. I'm not offended if you guys need to get out of here, but I'm going to hang around and talk to people.